Hi, everybody. Good job getting on our first remote meeting together.
Is now joining.
If you guys could make sure to mute your screen, that would help with feedback.
Hall
Is now joining.
And as people join, we'll try to remind them. I'll do a few reminders throughout. Also, there is a feature for live captioning. I am not sure, for those who might need it, if you may have to click on it and access that feature, but
Corey Ruff
is now joining.
Oh, it is working. So hopefully you guys are seeing the live captioning if you need it. This is a test. We've never done this before.
2 participants are now joining.
Hi, everyone. Please, just a reminder to mute, put yourself on mute. We are going to go through this staff meeting pretty quickly. I am recording it so that if anyone was unable to attend can access the meeting. I just have on the screen the staff meeting agenda so that we can run through it and I don't miss anything, and I don't want you guys looking at me, so that's why I have the agenda up. Anyway, this might be the way that we conduct business in the future. As you know, I sent out a notice about COVID-19. Parents were also notified, but the purpose of this meeting is to discuss our plan of action for how we can support students in the event of a school closure and planning for staff illnesses. So first of all, thank you so much for everyone who filled out the survey. That survey is giving us information as we plan for possible school closures in the future so that we know what is needed, what you guys have access to, and looking for how we're best going to support our students. So that is the intent of this meeting. I am hoping that everyone, please, if you just got on, if you could take it off, put it on mute, so we don't get feedback, that'd be great. Thank you. Everyone should have received an email explaining our community mitigation measures. Basically, we've been in very close contact with the public health department. Again, a reminder to put yourself on mute so that we're not getting feedback. And the public health officer has been guiding all the superintendents within Placer County, working closely with Yolo County, Butte County, and Sac County, because obviously COVID-19 is not something that stays within county boundaries. And they have been giving us guidance and recommendations on how we should proceed. So initially, a week ago, they had asked us to up our cleaning measures, which we did, and take all the precautions that we could, in addition to increased hand washing, monitoring coughs, that sort of thing. Now we're in a next level, which is it has spread, obviously, and we're not able to contain it like they had hoped before. There were keeping people in quarantine. Now it has spread to the point where we need to try to mitigate the community spread. So in order to do that, we have moved on to this next stage, which that's what the latest letter that went out last night to all of you was about. There was also, and I have here, if anyone has any questions, I think I'm going to hold off questions till the very end, and I'll let you guys type in the questions on the comment section when we get finished with the details. So we'll hold off on questions, but if you have any questions, if you can make sure you read thoroughly the letter that went out, that would be great. Also, a letter went out to parents last night, communicating pretty much the same thing that was communicated with you. It wasn't specific about illness. One of our nurses brought to my attention that it's very vague, but that is because COVID-19, you might not even know you have it. The symptoms for a healthy person could be very mild to minimal. It could appear like a common cold. It could be as severe as a flu, but we don't know. So we are taking all precautions that if someone's feeling ill or someone at school, kid-wise or staff, is ill, we're going to take precautions and send them home. So there is a new protocol about that. If you're a teacher and you have a student who is sick, please contact the nurse. And if the nurse contacts the family and the family refuses to pick their child up, that's going to be an immediate phone call to the coordinator. We are going to be very strict about making sure that anyone who is exhibiting sickness is not in our school settings. Okay, the next thing, please note that if you have a laptop, so many of the itinerants do, and hopefully some teachers, but if you as a teacher don't have one and need one, we know that based on the survey if you filled it out. We would like you to take home a laptop every day because everything is changing minute by minute. We don't know if schools get closed, it will be a last minute thing. And we are hoping that we can
Diana Porter
is now joining.
We will keep, we want to keep things flowing despite kids not being here, and how we're going to do that is what we're going to talk about, and it's the bulk of the meeting today. So please remember, if you have a laptop, bring it home. Just remember to not have it out in a space where people can see it in your car, because we have been known to have them be stolen. So put them in your trunk. But anyway, please bring them home because we don't know if school will get canceled at a very last minute. Okay, so number 6, if you can please look at the following table. This is sort of what I have put together in regards to and with my coordinators in thinking about how we're going to support students with remote learning and what PCOE needs to provide to make that happen. So for example, trainings on how to set up logins for Unique, etc. So you guys all know the work and the scope of practice that you do on a daily basis. So please keep that in mind, that when we're going through this, it was through my lens and it's probably missing a whole lot. So the intent of today's meeting is for you to leave with your brain thinking very actively on how we can support students if social distancing goes in effect, and how we can support students if we have to work remotely or have the kids go on independent study. Now, I will walk through the table with you, but I just want to note that our intent is to support our students, and so that needs to be at the center of what we're looking at. So I put the programs on the left based on grade level and programs, and when it came to, we're going to start.
Yes, I'm just making a phone call.
Is now joining.
Okay, can everyone this is a friendly reminder, please put your computers on mute. So if you look at the program and grade level, infant and Jumpstart, I'm specifically just talking about classes that we would have. So our next phase that the health officer could be instituting, and we're pretty close to it, is social distancing, which is where we have to keep 6 feet apart, which is hence why we are having this meeting via Teams. Now you're wondering, how is that going to happen in certain situations? Well, I agree. So if you look on the social distancing capability, 6 feet symptoms, no groups, I do not think, and if you guys disagree, I want to know, I do not think it's possible to keep social distancing of 6 feet for our infant program classes, Jumpstart classes, our ASD classes, our Deaf Plus classes, our DHH preschool classes, or our SMD. So these are just my opinion, and this is what I'm trying to do, is we're trying to formulate a plan of action.
Is now exiting.
We're trying to create a plan of action for what we're going to do, because these things could be happening and they could be happening soon. So where we did feel that social distancing could take place is in the DHH classrooms and the Deaf Plus. It's going to, I mean, not Deaf Plus, sorry, the ED classrooms.
Is now joining.
So you may be wondering, well, how is that going to happen? It will have to take creative thinking, but the goal from all superintendents throughout Placer County is to keep school open as long as they possibly can and to keep things going as smoothly as possible. The challenge is going to be that if a student or a staff is infected with COVID-19 and it is confirmed, a school will have to close down minimally for 7 to 14 days, likely 14. So things are still to be evolving. I'm hoping it doesn't happen, but it could be happening. But in order to mitigate that, social distancing is what they're looking at. So if you have listed here a social distancing capability, I want you to be thinking about how you would do that with staff, with your space. If the kids are unable to follow the directions of being 6 feet apart, for example, an ED, then they may not be able to possibly come to school. And that would be a conversation the coordinator would have to have with the student. With the student's family. So we have been given direction from CDE, Kristen Wright, who basically said, whatever we're doing for gen ed people, we need to do for special ed. That is a great directive, but as we know, it's hard. So we are doing our best to see what we can do. So that would be the first step, is social distancing. And if we can't have class, then we need to be looking at working remotely, independent study capability, and how we would do that. So if you look at each item, look at where you are, we anticipate, and this is a different and a change of mindset, but we are going to be needing to prepare ASAP. So that means effective tomorrow, we're going to need to figure out how to prepare for possible independent study packets or something for our kids. Amy Banan is going to be putting together a YouTube video to help teachers figure out how to get logins for their families when it comes to Unique, so that parents could access the online curriculum. And we also have the printing option of those Unique packets. It is our requirement that those students receive their curriculum if they're going to go on independent study. So that's going to be something we're going to have to look at. We're also going to need to, in DHH, follow whatever the district practice is, and also be thinking about independent study work we can send home. When it comes to preschool, obviously there's not a whole lot of curriculum, but if you could be thinking of activity packets you could put together for those families and for those students, and keep remembering that our kids deserve access to curriculum even if they're on an independent study. We are looking to see about the state lightening up on some of these rules for independent study due to the nature of this COVID-19 situation. We are waiting for guidance. But the reason that I brought you all together at such a last minute is because we can't wait, because these things could happen at 10 o'clock at night on a Thursday where school's canceled Friday, and we need to be prepared to figure out how we're going to get access to these students. So that's why I need everyone's brains sort of working out how they're going to do this. So then if you look at itinerants, I know a lot of you out there on the call are my itinerants, and that gets tricky. You guys, your biggest charge is always to support the teacher to access general education or special education from the home. And I put some examples, I talked through with my coordinator, some things that you guys could be thinking about preparing, because it's going to be a collaborative effort with everyone. SLPs could be preparing core boards, YouTube videos, figuring out videos that parents could watch to support their children. The AAC team could also help with that. Communication books for home. OTs could be looking at packets for tracing, sensory diets. I mean, this is just a very skeletal thing of ideas we came up with. So if you want to look over those, that's just a start. Maybe we're totally off base also. But the goal is we got to think outside the box when it comes to meeting the needs of these students, because they deserve exactly what gen ed gets. And a lot of schools have one-to-one computer programs, and their teachers are going to be doing online learning, and we've been given the mandate, we've got to provide what the gen ed is getting. So we're trying to figure out how we're going to do that. And I know this is not easy, and it's absorbed a ton of our time just even getting this far on our plans of action. So anyway, to the right of that, it says school work program options. So if they were to go, what is that about? Shoot, I'm drawing a blank. Let me come back to that. Schoolwork program. Okay, I'll come back to that. Okay, number 7. Now that you all have teams, if you're on this call, you have teams and you have figured out how to collaborate in a group. You have the ability to put together a group. And what I would like you guys to be thinking about is you're not in this alone. Well, Carrie Hoffmeister, poor thing, and Mike, you guys are your own discipline, but you guys have each other. But a lot of us have partners in the same discipline, and I don't want you guys to walk through this alone, but you guys are going to need to put your heads together, and we are here to support as well. But you can use Teams in a lot of different fashions. And I'm going to let Bryce talk to you about that, because it may be a place that you want to share documents, or you want to share. I know everyone's in love with Google. I like Google too. But anyway, this is Teams. So you could use Teams to have conversations with each other. You could video chat. You could store documents. So if you're a speech therapist and you have some ideas on prepositions that you could send home or what you would share, we could house that stuff in Teams. So here's Bryce to talk further.
So like Teresa said, we're going to be creating Teams drives. So all of the special education teachers are going to have a Teams drive. We've already created one of them. So I know some of you are familiar a little bit with Teams. If you're not, they're going to have a Teams. And one of the things we're going to have is, for example, special education teachers. It'll show here. Inside that special education teachers, there's going to be what we call channels. And they'll have ASD, DHH, ED, SMD. You'll be invited to these different organizations on Teams so that you'll be able to start sharing information with each other in order to help share resources so that families will be able to access this information as best we can. We realize that, again, this is a lot of information to get thrown at one moment, and being able to start preparing curriculum this quickly. But this is kind of our charge. The other thing is that traveling to meet with each other, I think that there's a lot of ideas. For example, we have ASD preschools, we have SMD classrooms that are across the county from each other. This is a good opportunity for you guys to use Teams in order to make calls with each other. We're going to be looking at getting webcams quickly for you guys to be able to hopefully be able to collaborate. Most itinerants have laptops that have webcams on them, so you should be able to have connections with each other through your webcams, and you can make calls through Teams. It's a pretty easy process, and we can hopefully ask IT to maybe provide some information on how to make those calls and set those up. One of the things is, and we'll make a YouTube video tomorrow about how to make a Teams meeting so that you can actually set up a meeting with a colleague and you can actually join the meeting just like you did today. We have 63 of you or more on this call today. I know some of you are sharing computers, so obviously you were able to do it, so congratulations. I know technology is not always the easiest thing, especially at a last minute. And so we really feel like we have the capability to work together as a team to be able to really share those resources. So if you want to collaborate with a colleague from across the county on, hey, I have this goal and what are your thoughts? The Teams drive is a good way to be able to share those resources across the county and possibly be able to have a video chat with them. So those information will be coming as quickly as we can get it out.
All right, everybody, back to the agenda. If I just click on this, does that take, yeah. Okay, so I also want to state that we are sending staff home if they're exhibiting illnesses, and we're doing the same for children. And I anticipate, because of the directives that were given by the public health officer, that you are to be symptom-free for 72 hours or at least 7 days, whichever comes first. This is going to have a huge impact on our classrooms and supporting our kids. So we have been working very diligently with some plans of action. If classrooms are short, who will fill in? That's why we sent out the survey, who has credentials that could fit. We are all on overload right now trying to figure out a contingency plan. I do want to say that if certain sites end up closed because, say, Loomis Union says we're done, we're not having school because we have a documented case, we may be calling staff to go to other sites, because we anticipate that that's going to be one of our ways to support each other. Every day we are looking, if you can communicate with staff around you that if they're going to be out to put into frontline ASOP the night before as much as possible, because any planning we can do ahead of time is going to be better than the morning of. But I have communicated with all the districts to notify them that if in the event we have to close the class because the safety risk is too great for the kids because of the lack of staffing, we will do so. So we are monitoring that very close and constantly. If social distancing comes into effect, teachers, teaching assistants, and behavior support assistants will still go to work. Most of you have enough space in your class to have your teaching assistants on different corners of the classroom, and you should be able to monitor your 6 feet distance. The only challenge is going to be is if your office happens to be in a place where you can't be 6 feet apart. So I know some of you are stuck in cubicles elbow to elbow. We will need to come up with a plan of action for you. We're going to have to find an alternative space, and that could be your home. HR is looking into other options if staff are out sick and required to stay home. Sorry for the typo. Keep a lookout for an email from Colleen. We understand that some people may not have sick leave, and that may be what forces them to come to work. We are trying to lighten the burden of what we're going through right now as much as possible. So please share with your TAs and your behavior support assistants that more is to come from Colleen. Okay, that is the end of my agenda, and I'm sure you guys are full of questions. So I'm going to go to, and this is my first time, so
I'll just look at it.
if you can look at the questions. Uh-oh, I don't know what I'm doing. Sorry, guys, you don't need to see Visio. I don't know. Oops. Okay. I want to say thank you so much that in such a last minute, you guys were able to download Teams and get this going. This may be the wave of the future, especially when we think about, man, I hate driving up to the annex for a staff meeting. If we can make this happen this week, we will do this. And it appears that we can make it happen. So, okay, I now have the screen, and now I'm looking for chat.
So if you have any chat information that you want to, or questions, you can go ahead and enter them in the chat, or you can unmute your phone, just say who your name is, and then we'll go ahead and ask your question.
I have a question.
Okay, who is this?
This is Katie Rotten.
Hi, Katie.
Hi, Teresa. If they make us stay home because the school is closed, are we going to get paid?
That's what you need to look out from Colleen. Yes, the
Okay.
goal, well, whatever Colleen is sending out, it's addressing specifically that. So
All
that's an HR question, but
Okay,
yes.
thanks.
So a couple of questions are coming in. If
Slow down questions.
Okay, hold on.
Just kidding. Okay,
Yes.
Kelly Darbo, if a school district has confirmed cases and shuts down for 14 days, wouldn't that staff be precluded from filling in at other sites? No, you would not. You just would not go to that school site. We have itinerants, and you guys, it's business as usual. We have not been given a directive that you are not to see students at varied sites. You would not be precluded from filling in at other sites.
Maureen, your question as far as having each student having a login for ULS, yes, that is a capability through the ULS system. Amy is going to be doing that YouTube video, and so that will be an expectation of teachers to get those set up. Amy was supposed to be at a conference for the next 2 days, so she will be available to help teachers get those set up as soon as possible.
Okay, Tori, what are approved classroom web pages for teachers to post on for students? That's a really big question, Tori. If you have specifics and can send a separate email to Cindy, let's work that out, because it's a big question. Carrie, if parents decide to take children out, or if schools are closed, could parents take LI equipment home if they transport that equipment? If they need it for their access to their education in the home environment, they could, but we would need them to fill out that form, that home use agreement. In the event that your site is closed, do IEPs still happen? We're going to take that site by site. IEPs right now are still to happen, even if social distancing occurs. We're just going to have them in bigger rooms and keep distances. We will follow that. We don't know what we're going to do in the event of that, because we have timelines we have to meet.
That we're going to be working with the district directors on that specific question, Diana. At this point, though, the state hasn't given guidance on if they're going to lax deadlines on IEPs. And so we will get more guidance as that comes down.
Okay, Katie, you said, what are specific symptoms that are included in the stay home if you are sick for whatever amount of time? This is going to be a very attorney type answer. It all depends. The issue with COVID-19 is that you can have it and not have symptoms. Too severe, they could mimic allergies, and you could have a runny nose and it be COVID. We don't know. We are leaving it at the staff's discretion. If you're coughing though, we're probably going to send you home because it's droplets, and coughs usually produce droplets. And but it's mostly respiratory symptoms that COVID-19 has. It's usually high fever or fever, fatigue, headache, sore throat. I have allergies. I pretty much have a headache and a sore throat and am tired all day long, but I know I am not sick. I have allergies. So it's going to be at your discretion. And it could be our nurse's discretion. If we feel that you're sick, we're going to send you home. And it's not to be that we're discriminating against you. It's just, we don't know. And we're not advising people to go get tested because we don't want to flood the hospitals for those who truly need the care. It's lighter than a flu most of the time. The people that it's at risk for really are the elderly and the medically fragile. All of us, Bryce, Brett, and myself have been contacting our SMD families to let them know that we are taking this very seriously. And if they have concerns about sending their kid to school, they will not be punished or penalized for absences. So we're looking at getting a waiver for that. Maureen said, should you cancel site trainings? Some are small, some are large. I need you to talk to Jill about that. There is guidance in the letter about trainings, and we are pretty much canceling. PCOE staff are canceling
Gina Hall
any
Is now
events,
exiting.
and they are canceling all trainings where outside people are coming in. So that's going to be your call, and you'll need to coordinate that with Jill.
It also will depend a little bit on the district site, because some districts are saying, yes, we're still conducting, and some are saying no. So you may want to contact the organizer from the district.
Right. Haley, you asked if social distancing goes into effect. Natalie Leabuff wants to know about toileting diapered students. If you look at the chart, social distancing is not a possibility for the DHH Plus programs because of that reason alone. Holly, if we have a blind student who are provided one-on-one aids to help them access their curriculum throughout the school day, what will happen when they are sent home? We have quite a few who cannot see the computer screen and require assistance for basically everything. That's going to be a case-by-case basis. Tori, will offsite classes get extra cleaning supplies? Every single school district has upped the ante to the highest level of disinfectant at night from their custodians. So that went into effect 2 weeks ago, and everyone should have got a notice about that. If you need cleaning supplies, we will grant them. But remember, things that have bleach and can kill this virus require specific training, according to OSHA. What happens if the school we receive lunches from closes? Then we're likely going to close because kids have to have access to lunch, or we may, I don't know the answer, Justin, or we may purchase lunches on our own. We'll have to follow that. Do I need an emergency credential to substitute for PCOE?
Craig, is that if your site, Craig, I'm just assuming that if your site closes and then we're asking you to redirect, that would be a no because you already hold a credential. I'm not, if that's what you're asking.
Natalie asked a great question on how many hours of work do we need to prepare for students. You got to be thinking about what you would be providing them in a regular school day. I know that that's super hard, but you take out recess, take out lunch, take out downtime, and look at the instruction you're actually providing and have it mimic as closely to that as possible. That's what they're doing in Gen Ed.
One of the things that to consider is that the idea is that if a closed school was to get a student with COVID-19 diagnosed or a staff member, they may have a closure to up to 2 weeks. So considering that.
Oh, yeah. I didn't know if you meant duration or per day. So likely we're looking at a 2-week closure. So be thinking in terms of a 2-week time span.
And that's going to be, obviously, you're not going to be able to probably prep 2 weeks of material in advance. So some of that is the importance of having unique curriculum online, and then also being able to make sure you have your parents' emails and being able to push curriculum out through there as much as we can.
Kim, you have a great question. We cannot communicate with many of our students via email or electronically due to district privacy. How will we share materials and communicate remotely? Those sites are working through those details and will have platforms in which students will either have a computer and a domain that the teachers would have ability to communicate with their students. And all my itinerant folks, your role is supporting those teachers and those students in Gen Ed. You're going to be working in collaboration with that teacher. I don't know. And if I'm not answering these questions, just shoot me an email or call me later. I'm trying to go through this fast because I know no one wants to be here till midnight. If Horizon Charter closes, they propose to be closed as of Wednesday. Are we to get parents communicating via Teams? I believe they may use Zoom for similar communication. Should I get access to their technology? You might want to talk to Horizon, Mike, and find out what they are doing and what they're providing. They're all independent study kits, and I'm not sure. I'm assuming that they are using the computer for support, but that's a separate question.
And I would also ask, Mike, is what is their expectation for you to provide services during their closure? Katie, if a service provider is absent due to being sick, what can we do to reducing the need for making up services? What will we need to be making up service hours if we go into the independent study model? So we have students out.
Okay, students out or
Both.
service
Staff out
provider?
and-
Okay, so let's address service provider. If you're sick and you can't make up the sessions, we're going to monitor that. We're going to try to make them up. If we can't, we owe comp ed, unless the CDE and the governor and Tom Thurmond come up with some sort of agreement that due to the state of emergency we're in, that they're going to not mandate those services. But at this time, we have not been given any lax in requiring services. Now, if the students go home, we're just going to document that they went home, and there is some language in Ed Code about independent study and related service providers, and I'll look into that and get that for you. But you can't. We're going to try to support the families with communication at home or OT services, but you're not going to be able to go to the home and provide it. So we'll have to sort out the legalities of that. And I apologize for being vague and not specific, but this is completely new territory for all of us. So I appreciate the patience and understanding that I don't have all the answers. Maybe we'll be an expert in 5 months. I hope not, but it looks like we're going to keep going this.
Diana, as far as if we're going to have to make up the dates if we close, we'll apply for a waiver from the state, just like we did with the Butte County fire. We did not have to make up those dates.
Michelle Johnson, please contact Horizon for Zoom, or you could do an IT work order to get Zoom for your, do an IT work request for Zoom and ask for it. Hopefully IT can help you. What else? Clarification, are we supposed to be practicing social distancing with students at this time? No, the public health officer has not said that is a mandate. It's a recommendation, but obviously if you're working with a student and you have to guide them or you have to work Braille, we're not there yet. What the public health officer is saying is please wash your hands frequently. It is the biggest deterrent of this disease, in addition to not touching your face. So if you can wash your hands frequently and not touch your face, hopefully that's good. Our NCI training's already scheduled.
Justin, I'm in the process right now of working with Sarah in order to contact us in regards to the last NCI we have is a refresher, which is a 4-hour training versus a full 9-hour training. We're in the process. It will be canceled, the one in March. The question is, will it be rescheduled this year or will it be rescheduled in the fall? We have to look at an extension for those individuals whose NCI will lapse over their 2 years in order to see if we can get them an extension so they don't have to go through the full 9 days. I'm not canceling the meeting just yet, just because that was something that we just are working on just today. We're just trying to keep up to speed as quick as we can. But yes, the NCI that's I think scheduled for the 24th and 25th of March, that will be postponed.
Natalie wants to know about workability. Workability, CBI and field trips are canceled for all PCOE programs. So CBI and field trips. Now, when it comes to workability, if a student has a job that they have to report to, they are expected to go. But if they can do any workability tasks like filling out a job application or anything, they should do that within the classroom setting. But if they have a job that they are to report to, that is an essential function of their day and they are to go. But field trips and CBI are not happening. Please make sure activities happen within your classroom setting that emulate that for preparation for the community. Amy Eibel, what are the home visit guidelines for infant and Jumpstart? For Jumpstart, what about parents and families visiting the classroom? So we are trying to limit visitors as much as possible to classrooms, but if it's for a referral or a placement, we're going to still continue with the daily functions, but we're not going to have people just coming to visit for the sake of visiting. It would need to be for a purpose of placement or instruction. When it comes to home visit guidelines, you're going to follow the same guidelines, but I do think Heidi's going to talk to all of you guys after this meeting about some safeguards for you guys in looking at how to keep yourself safe when going to homes. Natalie, if we have to, Natalia, sorry, if we have to close for any period of time, would it affect our April break? It could. We don't know what schools will do. For example, Elk Grove took this week off, and I think in lieu of their spring break.
Yeah, they moved their spring break from April till now.
So I don't know. We will follow. If you're on a district site, you're going to follow whatever that district does. Now, if you're an itinerant, we will deal with your calendar as we go through it. Any other questions?
Yeah, this is Andy.
Hi, Andy.
Hey, what if we already have tickets purchased and hotels paid for and everything for spring break, and we have to, what do we do with that then? If we end up having to do that.
Nobody's asking you to do that, but I will tell you that the public health officer stated that if she was any of us, she would not be traveling at this point in time anywhere. But we will cross that bridge. I'm not going to mandate that you, whatever, and you're an itinerant, so you're not at a site. It would be different. I don't have answers yet because every site's going to be different.
I don't think that that's anyone's intentions at PCOE though to take away spring break. And
right.
I don't think we're not looking to do that.
And I'm hoping school districts won't either. When it comes to what is the next question?
CPR. Yeah, CPR will be canceled on the 31st.
Yeah, CPR will have to be canceled.
Those cancellations or postponements for not for IEPs, that was a mistake. For NCI and CPR, those will be coming. We're just, as you can imagine, we've had a lot going the last couple of days, so we're just trying to keep up as quickly as we can.
Okay, as we wrap up, I would, moving forward, what do you do after this meeting? If you can take a look at my chart and look at it through your expert eyes as a teacher, as a provider, as an audiologist, as a DHH teacher, through all your different lenses, and provide feedback to myself or your coordinator on other creative ideas on how to support our students, that would be great, because I have to have a documented plan in place. Well, I was supposed to have it last Friday, but I couldn't come up with it on my own without all of you on our contingency plans and our contingency plans upon contingency plans. We are really trying to get ahead of not being reactive, and it's moving fast. So I appreciate so much everyone's cooperation, your participation in this meeting. I just got another question. That's Jenny, please contact Cindy or Shelley about that. Will we be able to utilize staff interpreters as part of curriculum delivery, even if they're at home? If you have ideas on what that would look like, please let me know, Haley. Again, we need
Mindy Kyle
is now exiting.
If you guys have ideas, let us know. We don't have this all figured out, and every school district is going through the same craziness right now to figure it out.
Just one more thing. I know a lot of people are going to say, I'm going to print out a whole bunch of stuff for ULS. I'm just going to speak up for Justin. Justin does a great job. Please understand that I'm a little worried about Justin's stress level if he gets about 15,000 pages to print in ULS tomorrow. So please, if we can try to, I know typically Justin gets most of the ULS printing requests. If we can try to do those as much of on our own as we can, please try to be mindful if there's, if we need to look at flex time in order to get those kind of things printed after school. I understand that Justin's capability to be able to print all ULS right now in this kind of a little bit of a crisis is just not going to be totally capable. And so please understand some of his capability to be able to accomplish that. Okay, thank you.
All right, everybody. I appreciate your time. Well done. And email me any separate questions or your coordinator for specifics. We will see you all later.